Okay, good morning, everyone. I am embarrassed to say this is my first time in Thunder Bay, and I am very happy to be here, and I'm very happy for the invitation. It's a lovely city, and we've been engaging with EPID at work for many years, and so it's great to kind of be here in person and meet folks. And so hopefully over the course of the day, I'll get to connect with people individually. Um, and so today I'm going to be giving a talk on a topic that I think we all kind of see, we maybe use, but there's a bit of a kind of a mystery that surrounds it, and that is artificial intelligence. And so, uh, in today's conversation and keynote, we're going to be doing a bit of a learning. So we're going to learn about what AI is. We're going to be learning about like how it exists within our work environments. We're going to think about what that means in terms of how it's going to change our physical and psychosocial work environments in a way that will impact our health. And we're going to think about AI as a potential health and safety tool, as well as a potential challenge that it poses to us. I'm not going to be able to talk through every nuance of this very complex topic. So this is kind of a high level talk, and it's meant to kind of be for those who are new to the area. But it's a lot of work based on the work that we're doing at our organization. And so hopefully you'll see some of this come to life. I know this is a research and practice talk. And so there is some data. There is some data, but I will try to kind of provide high level presentations of it so it's not too overwhelming for those who get a little scared when they see graphs or data points. And so again, happy to take questions at any point and clarify anything that might feel a bit mysterious to you as we go along. I just want to give a plug to our organization, which is also generously funded by the Ministry of Labor, Immigration, Training, and Skills Development, and that is the Institute for Work and Health. We're based downtown Toronto, and we have a very close relationship to EPID at Work. I like to believe that EPID at Work is our unofficial cousin up north, and so it's nice to kind of be amongst family. And we do research in kind of two broad domains. The first is how health impacts work, and the next is how work impacts health. And so colleagues at the organization are multidisciplinary. We span a lot of different research studies that kind of fall within these two buckets. And we take a great pride in working with folks in the field to ensure that our research can be applied to policy and practice. So just to give you a bit of a snapshot of some of the work that we do research in the area of mental health at work. We do a lot of research on the future of work, which is kind of my main area of research over the last few years. We kind of tackle long-standing issues in occupational health and safety. We think about the organizational and psychosocial context, and we're thinking about equity at work and inclusion. And so we're trying to take this focus on the workplace, workers, and systems levels. And hopefully you'll see this in this presentation. One other kind of plug I want to make is that a lot of this work that we're going to be presenting on today has been based on about 5 years of kind of lead up work to a recently funded project. And this is through the Social Sciences and Humanities Research Council of Canada. So we've recently received about 7 years of funds to bring together a diverse team of partners and researchers at the intersection of AI, society, work and health, occupational health. And the goal is to kind of build critical evidence to understand how the impact of AI will also influence the health and well-being of workers. And what we've seen is there's actually very little evidence on this. And so we're working collaboratively with people to kind of build out that evidence. And I'm delighted to say that EPID at Work is a partner and will bring a unique northern perspective to that work, a perspective that we in Toronto don't have. And so it's really critical that this organization is involved with it. Okay, so that's a bit of an introduction where I'm from, the projects that inform the work that we'll be talking about today. Okay, so what is artificial intelligence AI? Who uses AI? Put up your hand. Oh, wow, this is great. Who knows what AI is? Okay, so there's a bit of a disconnect. We're on ChatGPT. We are using Copilot. We are engaging with AI, but this is kind of the reality. We're using it, but we actually don't know what it is. So let's maybe just start very fundamentally. What is AI? Okay, so AI is actually it's an umbrella term. It's not actually the thing that we're actually engaging with. And so when we think about AI at a broad level, it's defined as computer systems that solve problems that traditionally required human intelligence. So anything that kind of falls within this umbrella term is AI. So there's some specific forms of AI and ones that you might be aware of. The first is machine learning. So this is the application of algorithms to large and diverse amounts of data sets. And the goal by doing this is to detect patterns in data, make predictions, generate decisions, or optimize processes. So it's kind of like a data analytics tool that allows the AI to make a prediction about what's going to happen or what to do or what you need. And kind of then within this kind of umbrella of machine learning is deep learning. And a lot of the new AI tools, a lot of the big advancements that we are engaging with today are actually based on deep learning. And this is where the algorithms are structured like the functions of our brain, the way that our neurons in our brains connect to one another. So this is the same way the algorithms are structured. And in doing so, these algorithms can make decisions or operate in ways that allow us or allow the machine to match or even sometimes surpass human intelligence. Okay. And so a lot of the big advancements, for instance, ChatGPT, that is based on a very sophisticated deep learning neural network. Okay. And so we're seeing kind of advancements in this area that are stemming from research and innovation in the area of deep learning. And so, as you might have kind of obtained from that previous slide, there's kind of three big building blocks in which AI kind of functions. The first is algorithms, the second is data, and the third is computing power. And so the decisions we make when creating the algorithm can determine its functioning. So the parameters that are included in those models, those algorithms, the ways in which work is captured, the way in which health and safety is captured, that will determine the way that it works within the work environment, the way that it functions, the way that it makes predictions. Data also is like the kind of the fuel to AI. So the types of data sets that we use, who's captured in those data sets, how is that captured? That all determines, again, what the algorithm learns and the types of predictions that it makes. And so if we have a very narrow data set, then the AI won't be able to understand there's broader kind of circumstances that surround a specific issue. And so we'll talk a bit more about this. But one thing I want to highlight is that the sophistication of AI allows it to consume both like numbers, like kind of data that we know, but it also can consume pictures, videos, all sorts of data, and that allows it to make predictions not just based on raw numbers, but kind of the world around us. So that's also an important circumstance. And then one kind of catalyst to this kind of recent AI acceleration is the growing strength of computing power. And so in you might see in the news like big tech companies are just proliferating AI developments, and that's because we're now able to support the learning of these algorithms on large data sets and complex data sets. And I think that's important to highlight that things are kind of rapidly advancing. One point I want to highlight is that AI is not a standalone technology. You're often engaging with AI on your phone. You're often engaging with it in your car. You might be engaging with it in a robot. So sometimes it's hard to kind of understand like what is the AI and what is the other technology. And that kind of creates kind of confusion in terms of how it's impacting our day-to-day working life. And that's something that we're still kind of grappling with in our own research. But I think it's important to highlight that it's often used in conjunction with other advanced technologies. For instance, in automated vehicles, it's often utilized with sensors that are detecting what's going on, feeding it data, and allowing it to make that prediction. Okay, so this was like a high level crash course on what is AI, what are the big building blocks. So how is it impacting our day-to-day working lives? This is an area that's still kind of unfolding, and so I think we're still learning about how it's shaping our working lives. But I think one thing to highlight is that AI is now existing in almost every industry, and there's examples that kind of show us how technology can manifest at work. Mainly, AI is being used to augment or even enhance the work performed by human workers across a broad range of occupations, including those that require physical tasks, as well as those that require more cognitive demands. So it's not just about putting it into a robot and having that robot like move boxes. It's being used in law, it's being used in medicine. There's a lot of applications that are growing. In some cases, AI can be used to automate entire occupations, but that's actually very limited. In most use cases, is actually being applied to more specific job tasks within the day-to-day working lives, and that's then opening up or freeing up time for workers to then perform other tasks. But I think the one key issue that's kind of emerging from the AI revolution is that it's changing the way that humans are interfacing with working lives. It's reorganizing the tasks that we perform. It's reallocating it to more intelligent machines and opening up or freeing up time for us to do other types of tasks in an optimistic kind of perspective. And so there's a lot of data that's starting to be collected on to what extent are workplaces utilizing AI. Some suggest that we're actually not utilizing it that much. Others are suggesting there's wide utilization. And so I thought this was a good stat because it comes from Statistics Canada, and then it indicates that about 12% of Canadian companies report adopting AI to produce goods or deliver services. And I think there's some regional differences and there's occupational and industry differences, but I think this shows that there's still like kind of room to grow in terms of organizations adopting it. But I think one thing that the data continues to show is that a lot of workplaces are interested in utilizing AI. There's a big kind of motivation of thinking about how AI can help us reduce costs, make work safer, make work more productive. And so I think this conversation is one that's going to continue to grow over time. And I don't think this 12% is going to be static. It's going to change. And we're going to see a lot of companies turning to AI to solve really sticky or complex problems. So in these surveys, when they ask employers, are you using AI? They also ask, like, why? Why are you using AI? Like, why are you turning to this tool when you can just utilize human workers? And there's several reasons that tend to come up a lot in the research. The first is that because of AI's ability to consume large amounts of data, it can allow us to produce predictions that maybe in the past human workers could not. It can synthesize data in ways that we might not be able to. And as a result, it could be more accurate in the way that it performs tasks. It can perform tasks to greater efficiency. The ability to do more complex tasks might have a cost savings for workplaces. We're seeing in a lot of really complex industries like medicine or medical development that it actually allows us to innovate, because by producing these insights that we couldn't do in the past, it allows us to target where the drug should be treated or how we can then create a new output. A lot of workers or a lot of workplaces are indicating that their use of AI might also be stemmed by worker shortages. They just didn't have people to perform certain jobs, and all of a sudden this tool existed and they could slot it in, and there's a solution to the fact that they couldn't do it. And oftentimes the human workers might be more expensive, and that might be a catalyst. They want to reduce costs. So these are some of the reasons why employers are talking about using AI, but it just highlights there's a lot and it's going to continue to change. Okay, let's look at some examples. So AI is often utilized in medical settings. Here in radiology, AI is used to detect cancerous lesions. And what the research is consistently showing is that the ability of AI to scan an image and detect a cancer or detect cancer it's very, very accurate. But what the research is also showing is that when you couple an AI system with a medical, like a human physician, the two together can increase the probability of cancer detection. It's like 99.9% likelihood of detecting that cancerous lesion. So the combination of humans and the AI together can kind of lead to the best outcome. We're seeing in fulfillment centers that a lot of major companies are turning to AI robots that allow us to kind of pick up objects, move them to different parts of the warehouse, fulfill different orders, and they're often working side by side with humans, and they often call these cobots, but these are informed by AI. They're utilizing sensors. They're constantly consuming data, and they're making predictions about where they need to go and how they need to get there. If you go to contexts like, or places like San Francisco, you're going to see a lot of driverless taxi cabs. Again, these are utilizing sensors and AI to explore the built environment. They predict where the person wants to go. They predict the best and safest route of getting there. And they've shown to be quite an effective mode of transportation. Again, the research consistently shows that the use of AI is helping to save fuel. It's making safer predictions on where to go. It's seeming to be a very like effective alternative to more traditional taxi cabs. Obviously, this creates a whole set of questions about insurance and what happens if there's an accident, what happens to the worker that can no longer work as a taxi cab driver. But again, these are examples of how this is playing out in our day-to-day working lives. A lot of large language models are being implemented, which allow us to create movie scripts. So these include like the text to a movie script, the videos, the images that go along with it. And all you need to do is type a prompt into these systems and they can create an entire movie for you. So this is just interesting. These large language models are just taking a few points of text and can create a whole scenario based on that. So these are a couple examples. There's many others. I think as the technology becomes more and more powerful, we're going to see more and more of these use cases exist within our working lives. But I think one thing that I really want to emphasize here is that a lot of these applications are very narrow. So what this means is that they're applied to specific job tasks rather than the entire kind of occupation. And they allow us to oftentimes work alongside these tools. But many believe that as the technology will continue to advance, as algorithms become more sophisticated, as computing power becomes stronger, that we're going to kind of move towards a stronger form of AI. And they often refer to this as general intelligence. So here, many believe that we're not too far off from a time in which AI can operate independently the same way you and I can. They can play a role at work or in society that is independent from any human manipulating the tool. And so obviously creates a lot of fear of having these kind of intelligent beings amongst us that are created based on technology. But I think it's going to open up a whole can of worms in terms of what that means for the work environment, the rights that AI have at work, what happens if there's an accident at work. There's a lot of unanswered questions that we're trying to grapple with. So I think one thing that I would love for you to take away from this presentation is that this risk of AI taking over our jobs at this time is a bit overblown. And I don't think that AI is going to like fully substitute human workers, but that creates a challenge for us, right? Like we need to learn how to work alongside the tool, how to prompt it, how to navigate a work environment where AI is increasingly being utilized. And so economists especially have been kind of tapping into this a bit more and trying to understand like, so what jobs are at risk? What jobs will be exposed to AI the most? And what these studies consistently show us is that almost all occupations have at least some job tasks that AI can be performed. But again, no job is fully automatable because of AI. So for instance, one study in the United States found that 60% of occupations consist of a cluster of job tasks, of which 1/3 could be performed by AI. So that's a pretty considerable amount of jobs that there's tasks within those jobs that AI can perform. A more recent study that found about 20% of workers could have at least 50% of their job tasks performed or influenced by large language models. So again, this just kind of these data points bring to light the fact that a lot of our jobs have tasks that can be performed by AI. And I'm thinking about my own job. There's probably a large cluster of tasks that can be performed by these tools. And for me, it's important to understand how to best harness it, how to utilize it as a productivity tool, how to ensure that I can create skills that allow me to work alongside the AI and not be replaced by it. And this creates a lot of strategic kind of goals as we move forward. We want to make sure our most vulnerable workers aren't being displaced by this tool, but rather can harness it to improve their working lives. So let me show you some data that we recently collected in Canada. So this is actually based on Canada's Labor Force Survey, which is a survey of Canada's population. And we wanted to understand what jobs are exposed to machine learning. And so this is a small snapshot. One kind of key theme that we found was that no job, again, would be untouched by machine learning at work. But we also saw that no job was completely automatable by machine learning. And here I'm presenting kind of two groups. The first group are jobs where there's a high exposure to machine learning. So these are where a large number of job tasks can be performed by this AI subfield. And as you can see, there's some themes that exist amongst these occupations. Occupations like record management technicians, travel counselors, recruitment officers, customer service representatives, accounting clerks. These are all tasks that are somewhat repetitive on a day-to-day basis, They utilize or they make use of data to make predictions, and they offer kind of simple or more straightforward advice to customers. And so you could think about like chatbots taking these over, or machine learning algorithms being able to like plan your next trip. So these are jobs where machine learning would have a high exposure. And then on the other side, we have jobs where machine learning might have less of an impact. These include police officers, massage therapists, dancers, athletes. So what do these jobs have in common? One, they're highly physical. They're maybe a bit more random. They're less predictable. And so again, this might distinguish the jobs that are highly influenced or less influenced by machine learning. So it provides a bit of a snapshot of like where we should be targeting our energy as we think about this topic. As we kind of dive into the data, our research on the labor force survey also highlights is that there's going to be inequities in terms of who's affected by technologies like machine learning. And in our research on the labor force survey, what we found was that there's gender differences. That's one example. So we found that females or women workers were more likely to work in jobs where there was a high exposure to machine learning, so where machine learning could have a significant impact on their day-to-day working lives. And men were more likely to work in jobs where there was less of an impact of machine learning. So how can we interpret this? We don't know if the impact is good or bad, but we know that there's a pattern here. For me, this kind of is a good news, bad news story. The good news side, maybe women workers who've been traditionally disadvantaged in the labor market, they might have this tool, or they might be able to, they're working in jobs where this tool is more prevalent maybe, and they might be able to capitalize on it and make innovative benefits, or be more productive at work, or utilize it so that they can be more productive at work. Or they might be more exposed to the technology that displaces them from work and further widens this inequity. So we don't know the pattern and how it plays out, but we know there is a difference. And this kind of highlights the importance of doing additional research to understand what's like the day-to-day working life look like, and how is this impacting different groups of workers. I'm going to show you findings from a recent study that hasn't been published yet. So it's kind of like work that we're kind of working on and writing up right now. And here we're looking at the relationship between the quality of work, or whether work is precarious, and a job's exposure to large language models like ChatGPT or Copilot. And what we found was that jobs with the highest quality, where there was no kind of dimensions of precarity, they were more likely to be exposed to these large language models at work. Whereas jobs where there was some degree of precarity, like where there was maybe an unstable contract, a low income, there was just things were just worse off, they were less likely to be exposed to large language models. Again, there's a good news and bad news story here. One, maybe the more precarious jobs might be protected from these innovations, or maybe these innovations are more concentrated in these higher quality jobs, and folks in those jobs might be able to capitalize on these tools and have productivity benefits that further kind of widen this income inequality, or further allow them to kind of take off and make more money and be more productive and be more efficient at work. So again, we don't know how this is playing out, but we know there's some patterns here that we want to understand a bit more. Okay, so we see that AI is being used for productivity. We see that it's being used to make things more efficient at work, but are people using it for health and safety? There's a bit of a discourse in the health and safety community that it could be kind of the next thing to make workplaces more safe, but we don't know. There was actually very little data 3 or 4 years ago. And so we engaged in a survey of health and safety professionals in Ontario and British Columbia, and we tried to span a province-wide perspective on this. And what we found was that when we talked to health and safety professionals, just under 30% reported utilizing some form of AI for their health and safety practice within their firms. And we found about 50% or over 50% reported, I am not using AI for any health and safety practice. We also asked them about, is your company utilizing it for other types of activities? And what we found was that they were more likely to report, the same kind of participants were more likely to report that their companies were utilizing AI for other activities to be more efficient, to be more productive. So there's a bit of a gap here. We're using AI, but we're not utilizing it for health and safety. And so to me, this is kind of maybe a potential opportunity. Maybe we can capitalize on this tool and make workplaces more safe. But clearly there's a gap here. So in the same study, we asked folks who were users of AI for occupational health and safety, like, what are you actually using it for? And we got some common themes that emerged from the data. The first being that we used it to monitor safety behaviors. We utilized it to promote health enhancing behaviors like physical activity or mental wellness. We used it to prevent psychological injuries at work. We used it to eliminate hazards or identify hazards, prevent physical injuries. And so there was a range of potential applications. I'm not going to highlight the specific tools that they talked about using because I don't want to endorse it without having like some sort of like data on the efficacy of the tool, but these were some of the big themes that emerged. What we also found was that there were several kind of key reasons for people turning to AI. And this included to create a safer workplace, to address high costs, to address psychological as well as physical injuries at work. And we asked both users and non-users about potential impact of AI on occupational health and safety. And as you can imagine, the AI users were more like excited about it. They thought it would have a more significant impact, whereas the non-users were a little bit less excited. They said, I'm not too sure if it's going to have an impact on creating a safer work environment. So there's a bit of a gap there. And obviously that makes sense. The users are excited about the opportunities that it presents. Another kind of key theme that we found was that the folks that talked about utilizing AI were more likely to be based in a work environment that was more hazardous. Okay, so these are like the high hazard firms. And so what this is maybe telling us is that workplaces where there's a big risk of fatality or injuries are turning to AI to address maybe some of the most complex problems, to kind of deep dive into their data, to monitor behaviors, to flag when there's a potential issue that could emerge. And so this is kind of an interesting finding that the most hazardous workplaces were turning to this tool. Another interesting thing was that we asked participants about AI concerns. So what are some of the concerns that exist? And all participants kind of noted that they had concerns about utilizing AI at work. So for instance, like the cost of turning to this new technology, not understanding it, the technical expertise to implement it. These were all like concerns about utilizing AI at work. What we found kind of that emerged from the data was actually the AI users were more likely to report concerns about the technology rather than the non-users. So it's kind of like being exposed to the tool, utilizing it in practice. It allows you to see that there's strengths and potential weaknesses, and the AI users were aware of both. And I think this is kind of an interesting point that health and safety professionals ought to think about a bit more as we think about whether or not we want to utilize AI, is that we need to think about both the strengths and weaknesses. And by like not turning to AI or not trying to learn about it, we might be missing both and allowing our workplaces to think about how to best optimize the tool and where it could have a potential disadvantage. Again, this has been a whirlwind tour of the impact of AI at work, occupational health and safety implications. But one thing I kind of want to zoom in a bit more, and I want you to actually start to think about a bit more, is that we've talked that AI is a tool that humans have created to think independently, but the design decisions make a significant impact on AI's functioning within the work environment. And one of my kind of main goals over the next 7 years as we kind of advance our research in this area is to think about how can we incorporate worker identities, health issues and occupational health and well-being into AI design and implementation. So I don't have an answer to this, but I'm going to point out where thinking about this is critical. So if you know about AI, or if you're kind of in this field, or you're just like kind of passively learning about it online, you will note that there's a number of risks that have been documented in the literature and in media about the potential like negative impacts a poorly designed tool can have. So for instance, AI can hallucinate. It can make up information. Sometimes you might be on ChatGPT and what the ChatGPT is telling you is completely wrong. That's oftentimes called a hallucination. It believes it's right, but it's actually wrong. And hopefully we are smart enough to detect that. It can malfunction. Sometimes AI can perform a task in a way that we didn't want it to, and it can cause harm. It can be misused. Someone could take a very altruistic AI tool and use it for harm. That happens. The large amounts of data that are used to enable an AI tool can create privacy concerns. Do we want to be surveilled? Do we want constant data collection in our working lives, in our day-to-day lives? A lot of people have profound issues with this. The impact of AI is going to change our work environment, both physical and psychological. What hazards are they going to pose to our work environment? They're clearly going to change the way that we're interacting at work. Is this going to create new issues? And very lastly, the way that we design AI can create biases. And these are the unequal distribution of benefits of an AI tool. It might work for some, but it might not work for others. And this might exacerbate societal inequities that exist. And so let's dive into this. So there's a number of cases in real life where AI biases have harmed folks. And AI biases can emerge from two kind of domains, and there's other areas, but this is kind of the high level summary of it. The first is algorithmic biases. So if the parameters that we select in our AI tools, the way that it's designed, the kind of the architecture of the tool, if someone doesn't consider the diversity of the population in which this AI tool is implemented, the different dimensions of the work environment, it could create a very narrow AI tool that doesn't know how to operate when things change, and as a result, people could be disadvantaged by it. Also, if our training data is very limited, so for instance, if the AI learns off a data set that is homogeneous, if it's only focused on men, or if it's only focused on white people, or if it's focused on people in Toronto and not in the North, it's going to then only have specific applications or utility to those specific contexts and might not be applicable across a wide range of contexts. Let's examine a case study in which things went wrong. And when biases kind of perpetuated existing health inequities. So as mentioned, there's a lot of applications in the medical sciences for AI tools. And one tool that was created was a tool that was implemented into smartphones and allowed people to take pictures of their skin and allow them to detect if there was a potential cancerous lesion on their skin. So this was a breakthrough. People were really excited by this tool. They're like, the cost of going to a dermatologist or an oncologist to detect skin cancer is quite costly. People in rural areas don't have access to this type of care. This is going to change everything. And it was really positive. The outcomes were really great, but they were only great for a few people. And what they realized was that when the tool was applied to white people, it was very effective. 99.9% the tool was able to detect a cancerous lesion. But when Black users utilized the tool, it was unable to pick up the skin cancer in those individuals. And so the researchers who created this tool were a little bit perplexed. They're like, well, we thought we designed it in a way that incorporated all the clinical information that allows us to understand to detect a cancerous lesion. And what they realized was that the training data set that they utilized was based in a Scandinavian context, which was primarily white. There was very few Black individuals captured in that data set. So as a result, the tool was unable to learn or unable to predict cancerous lesions among Black users. And so as a result, they had to stop the utilization of the tool, and they had to kind of rejig the algorithm as a result to make sure that they were able to better capture different individuals. And so as you can imagine, this has the potential, if we're utilizing it widely, to further exacerbate inequities that exist, health inequities that are pretty pronounced. The Black community is often excluded from the health community. They often find it more challenging to get diagnoses or to get medical attention. And this could have just further exacerbated the issue. The other kind of point I want to bring to light is this kind of the impact of large data that is required to power an AI tool. So being constantly surveilled can create a huge amount of stress amongst workers. Am I going to do something wrong? Will my workplace know what's going to happen? Will I be punished if I'm not working the way that my workplace wants me to work? It could also create fear of like, how is my data being used? Is just big tech going to utilize my like data points and then profit off of it? Is my data secure? Do I actually have autonomy over how it's going to be utilized? And this can create pressures at work. It can intensify work. You might feel like you now need to keep up with the robot, or you need to keep up with those machines that are operating more efficiently than I am. They might change the way you feel about your control at work or how happy you are at work. Because if you're being surveilled, that's going to change your perceptions of the work environment. And there's a number of cases in which this is leading to like mental health conditions at work, is leading to psychological strain. It's just creating a work environment that is really adverse for humans. We're seeing this kind of play out in real life. So media is bringing this to attention. For instance, in fulfillment warehouses, people are working alongside those really technical robots, but then they're also now having to wear wearable technology that senses their daily movements, ensures that they're moving efficiently. And many people say, like, I just feel like I'm a component or a robot the same way that my like robot colleague is. And so like people are now feeling that they're being treated like a technology. Okay, 2 minutes. But there's some optimism here. We can kind of take control and autonomy over how we are navigating this AI work environment, and we're seeing this. Organized labor unions are now advocating for more protection for human workers against corporate AI utilization. And so a good example was in the Hollywood writers' strike. One of the key issues was that writers were saying that this is kind of ruining our work environment. It's changing our occupation. It's kind of worsening our field. And we think that corporations need to have some like guidelines on how AI is being utilized. And they were able to negotiate that into their collective bargaining agreement. And I think this is going to be an emerging and ongoing challenge that unions will face as they kind of negotiate new contracts with work environments. This is an area that I'm not an expert in, but there's a growing kind of movement towards Indigenous data sovereignty, with many Indigenous groups believing that the harvestation of data, the ongoing collection of data is very similar to a colonial kind of perspective where people's resources are being utilized without autonomy, without people's own kind of choice. And so there's a movement of different groups, including Indigenous groups, taking control over how they use their data and how corporations are utilizing data. And I think this is going to be another kind of trend that will gain prominence as AI is being utilized, and one in which I think will be an important one. How do we have control over what is being put forward? So today we've talked about how AI is designed, its potential implications for worker health, the fact that there's large data that are kind of that inform it, that decisions that are made when it's applied in the work environment, it can have significant implications for our health, safety, and our well-being. But there's kind of like two themes that I think we ought to be thinking about moving forward. And the first is there's actually very limited legislation. So we've done a deep dive into occupational health and safety legislation across the world, and there's very few legislative kind of approaches that are trying to address what this can mean for our health and safety at work. And I think what's also underpinning this is AI literacy. As this tool becomes more and more prominent within our working lives, we lack a potential literacy to navigate it. And I would encourage folks to kind of learn more, to gain more skills in this area, and hopefully through engagement with our group at the Institute for Work and Health and the partnership on AI and quality of work, that we can kind of work together to upskill our field to ensure that health and safety professionals and worker equity professionals are gaining the skills in AI that will allow them to navigate these very complex issues. So with that, I wanted to express my gratitude to everyone here and for the invitation to speak on this really exciting research. I also want to acknowledge we have a lot of funders that have been supporting this work, and without them, this research would not be able to move forward. So we want to express our thanks to that. Thank you, everyone.
Thank you so much.